Hello, everyone, and thank you for joining us today. My name is Angel Romero, Manager of Clinical Services here at Scripps Health. I'm here to guide you through a virtual tour of our cardiology departments. We'll meet a few people along the way and take a look at life inside Scripps. I'm here with Ronnie Farrell, one of our CV techs here in the Cath lab. Ronnie, can you tell us a little bit about yourself?
Sure. Going on 19 years in the industry. I came out from Orlando, Florida. I was originally here in San Diego when I was in the military. And I've been doing this in various capacities, management, staff, and industry for about 19 years.
It's a lot of experience. What makes the AMP Cath lab unique?
I believe it's our fellows program. We have a 2-year structural heart fellows program that allows the interventional fellows to gain a little bit more experience than they would and put them in a little bit better position as far as their jobs go when they go out into the real world. And for us, we get to be exposed to a lot of things that you wouldn't normally get exposed to in a regular cath lab.
And what do you love most about San Diego?
Location, location, location. It's close to the beach, close to the mountains, great place to raise kids, and I couldn't love it anymore.
I'm here with Sheree Trotter, one of our registered nurses here in the AMP Cath lab. Sheree, as an RN with a background in critical care, what do you enjoy most about working in the cath lab?
I think the thing I enjoy the most is the teamwork. Coming from the ICU, you get a lot of valuable skills, but coming to the cath lab, you work as a team, you work really closely with the doctors, and it's very rewarding.
What roles or duties do you perform here in the lab as an RN?
So taking care of the patients, being the primary nurse in the lab, and then also we're able to circulate, getting different equipment for the physicians. We're also able to monitor the patients in the lab. I'm also able to be a team leader, which is the charge nurse role in the cath lab, so there's a lot to do.
I'm with Steve Galdamez, one of our rad techs here in the cath lab. Can you tell us about a day in the life in the AMP Cath lab?
Sure. Yeah, we have very busy days here and very exciting cases. So they're not 2 days are the same.
What do you find unique about working at Scripps Health?
We have a very strong team and very involved people, and it's nice to kind of be involved in all these extremely difficult cases sometimes.
I'm here with Lea Schumacher, our RN supervisor here in the AMP Cath lab. Lea, can you tell us a little bit about yourself and about your background?
Yes, I'm an RN for over 30 years now. I've been here at Scripps for, since 1990, so 29 years. And I came here as an ICU travel nurse. I loved San Diego and I loved Scripps, so I decided to stay. And in 2002, I was asked to cross-train in the cath lab, and I really enjoyed it, and I never left the cath lab since then. I loved the positive energy of the cath lab, the rewarding aspects, getting a patient in and fixing whatever their issue was almost instantaneously, and the technology. I just really liked this kind of environment.
And can you give us a brief description about the AMP Cath lab?
Yeah, so we have 4 labs over here. In addition, we will use one of the hybrid rooms over in the Prebys cath lab as well. We do all different types of procedures from coronaries to peripherals to structural heart cases. Some of the structural heart include TAVRs and mitral valve cases, as well as PFOs, ASDs, and left atrial appendage closures as well. And we have a robust research department where we usually have 12, 13 cases going on simultaneously that could be anything from medications that they are analyzing, or it could be a very complicated procedure like the mitral valve replacements, also stem cell studies, and various other ones. We have a strong a fellowship program here. We do teaching. We have 6 interventional fellows, 3 first year, 3 second year, as well as some general cardiology fellows that rotate through. They learn from the attendings that we have 4 interventional cardiologists here who are well known and well respected in their field. And then we also have our own courses that we do each year that we host. One is the coronary interventional course in October, and another is the structural heart course in February. And additionally, we have courses that we transmit live cases to national courses such as the TCT and ACC courses.
There's always a lot going on. Thank you very much.
Thank you.
I'm here with Todd Frazier, our lead CV tech here in the Prebys Cath Lab. One fun fact about Scripps La Jolla is that we have an entire floor dedicated to cardiology. Can you tell us a little bit about the lab's staffing structure here in Prebys?
Our structure for our teams is 2 CVTs, 1 rad tech, and 1 nurse plus the doctor. And so it's a 5-person team working on the patient. And this, of course, varies from time to time, but that's our basic structure we work with.
Okay. Can you describe the lab culture?
Oh, the culture in our lab, I would say, is camaraderie, definitely. It's a teamwork environment, and we all work together to provide high-quality patient care. We all have different skills and knowledge, but it's the camaraderie of working together that allows us to get our cases done. And there's a healthy level of respect for one another.
That's awesome. Can you describe some of the procedures we're doing here in the lab?
Well, our main procedure is the selective coronary angiography. We also do, the full left heart, right hearts, and we do a lot of structural also, which includes mitral valves, aortic valves, ASD closures, and PFO closures.
Thank you so much for joining us today. We hope you enjoyed taking a tour of our facilities. Please bring your questions to the virtual career event on February 27th. We'll see you there.